Around 5,700 women are diagnosed with breast cancer every year in Switzerland. Breast cancer is the most common cancer among women in Switzerland and results in more than 1,400 deaths annually. Understandably, all women hope to detect breast cancer early, thus improving their chances of recovery. One early detection method is mammography screening, which involves taking an X-ray of the breast to check for the existence of tumours. However, a mammography provides no indication as to whether any abnormalities found are actually dangerous tumours or ones that are growing very slowly or not at all, and as such would never have been identified without examination. This can lead to uncertainty, and in the worst case to unnecessary treatment, making mammographies a controversial topic. Incentive enough for us to take an in-depth look at this subject. Helsana is committed to health and encourages personal responsibility and health competence. We put complex health issues under the microscope and highlight the facts. The Harding Centre for Risk Literacy has summarised the potential benefits and harms of breast cancer early detection by mammography on the basis of the scientific studies available. These long-term studies looked at groups of women over 50 years of age who did or did not participate in regular mammography screening. After 10 years or more, the participants and non-participants were compared. In each group, 21 out of 1,000 women died from cancer. In the group with mammography screening, 4 out of the 1,000 women died from breast cancer, compared with 5 in the group without mammography. 1 out of the 1,000 women who participated in the mammography screening was prevented from dying of breast cancer. Around 100 of the 1,000 women who participated in the mammography screening had at least one suspicious result within the 10 years that only later proved not to be breast cancer. Some of these women had to live with this uncertainty for months and go through further diagnostic testing before being given the all clear. In addition, 5 out of the 1,000 women were diagnosed with non-progressive breast cancer that was usually then treated with breast surgery, even though the cancer would probably not have caused any problems during their lifetime. In summary, the findings were therefore as follows. Mammography screening may reduce the number of women who die from breast cancer, but this has no effect on overall cancer deaths. Among all women taking part in the screening, some will be overdiagnosed with non-progressive cancer and unnecessarily treated. In light of these facts, each woman must ultimately decide for herself whether or not a mammography is a sensible option.